Hello and welcome to Shri Sunday New York Times Read Along. We will get started in just a minute. Our guest this week is Dr. Lipi Roy, a Forbes, MSNBC and NBC contributor. And our host, of course, is Sri Srinivasan. We're live on Facebook, Twitter, LinkedIn, and YouTube. We will get going in just a moment. Hello and welcome to Shri Sunday New York Times Read Along. My name is Neil Parekh. I'm the executive producer and occasional guest host of Shri Sunday New York Times Read Along. Our guest this week is Lipi Roy, an internal medicine physician and public health advocate. She's board certified in addiction medicine and is the medical director of COVID isolation sites for Housing Works in New York City. She's a Forbes, MSNBC, and NBC News medical contributor. Our host, of course, is Sri Srinivasan, the Marshall Loeb Professor at the Stony Brook School of Journalism and co-founder of Digimentors, a digital and virtual events consultancy. We are live on Facebook, Twitter, LinkedIn, and YouTube. Please like, please comment, please share. And without further ado, we'll bring on Sri Srinivasan.
Hi, everybody. Good morning, and hello, Neil, and hello, Lipi, and everyone watching from around the world. We're just so happy to have you all with us. This is our year-end show of the New York Times Read Along, and just so happy to have been doing this for 5 years. Neil's been doing this with me for about 3 years, and we are very grateful to this global community we've built. Lipi was with us on our very first time we talked in depth about the COVID crisis on the show, and now she's back again, and we are very proud of all the amazing work that she has done. So stay tuned to meet her in just a few minutes. First, Neil, aka Santa, is with us, and Neil is going to show us some of the front sections and other parts of the paper, and thank our wonderful team before we get started. I see people are watching. Jonathan's watching from the East Village. Hi, Jonathan. Thanks for all your support.
Doug Levy, waking up early from California. Thank you as always, Doug. And my mom, good morning, Mom. How are you doing? So the Parekh joining us from Hastings-on-Hudson, New York. And our friend Patricia Freudenberg joining us from New York as well. Ron Thomas, usually in Dubai, but in the States for the holidays. So Ron, thank you so much, and in particular for your support of the New York Times Read Along. Ron is one of our sponsors. Apollo is joining us as well from Montclair, New Jersey. Good morning, Apollo. Our friend Stefan Kaplan from Ramsey. Dr. Sujana Chandrasekhar, one of the co-hosts of She's on Call, our medical show that goes at 11 a.m. Eastern Time, right after this show. Diane Stefani from Margate in New Jersey. Thank you, Diane, for joining us. We have a number of people watching. Please share, please like, please retweet on whatever platform you're watching on. We have Miriam Barkley as well is watching on her television, but can't comment. Well done, Miriam. Hopefully that's a good experience for you in terms of the widescreen. But you know, if you wanted to, you could always have your phone right next to you if you wanted to be able to comment. But no pressure, of course. And of course, our guest today is Dr. Lipi Roy. We're so excited to have her here. There's so much to cover in the news, and we definitely want to get her insights, particularly on the vaccines and the increasing caseload, what we're seeing in California. There's hope around the corner, of course, but there's also some cause for concern, and we'll be asking Dr. Roy about this. The new strain in the UK. There's a new strain in, if I'm not mistaken, South Korea, which it looks even more a stronger variety of coronavirus. So we'll see how that goes. But first, we do want to thank our team. We could not produce this show without the great team behind the scenes. Paula Kiger, she's at Big Green Pen. Steve Taylor is at Steve DeRive. Julia Weeks at Julia L. Weeks, and Carla Baranauckas at Kabara. Paula, one of the things that we do with the New York Times Read Along that most live streams don't do is we have staff in Facebook, in LinkedIn, engaging with the audience, sharing links, answering questions, providing context for the show. So really want to thank Paula and Steve for their work on that. Julia has helped us with analytics, and Carla has done such a great job getting guests and also pitching in when we're live on specific platforms. So we really want to thank them for that, and let them know how much we appreciate them, particularly around the holidays. We also want to thank our sponsors. We have great support from Muckrack and Strategy Focus Group. We've done a lot of work with Muckrack over the last year. In particular, we have Shree's social media course. If you haven't had a chance to take it, it's Fundamentals of Social Media for journalists, PR pros, and everyone else. It's a free on-demand certification course. You can enroll at mrac.co/social. That's mrac.co/social. We've also done several webinars with them, and it's been just a great partnership. So we really appreciate all of the work that they've done. As I mentioned, another one of our sponsors is Strategy Focus Group. Strategy Focus Group is a global team of human capital strategists committed to helping organizations solve people issues within your organization. They do that by working alongside you to solve your toughest problems and helping you capture your greatest opportunities. Thank you to Ron Thomas from Strategy Focus Group. If you're interested in being a sponsor, please reach out to Shree or myself. Shree's email address is shree@digimentors.group, and my email address is neil@digimentors.group. You can learn more about our sponsors by following these links, readalong.link/muckrack or readalong.link/strategy focused group. Again, thank you for all of your support in 2020, and we look forward to bringing you more of these shows every week in 2021. Just because the clock is turning doesn't mean that we'll be stopping. We've been doing this for 5 years, as Shree mentioned, and it's been my pleasure to help produce the show for about 3 years. And occasionally, when I'm producing the show, I also step in to guest host. Usually it's planned and I'm scheduled to guest host, but it looks like I'll be guest hosting today. We're having a little trouble with Shree's Wi-Fi in Puerto Rico. Whoa, Shree's in Puerto Rico. Don't shed too many tears for him. It's like 80 degrees down there. And Santa Claus is definitely jealous. But if he gets a chance to join us, we'll definitely have him back on. But for now, I will be taking on the show. And again, in addition to the folks, and just into this is a little sad. I wanted to be able to say hi to Shree's mom. She's joining from Kerala. Auntie, I'm sorry I'm not Shree, and you don't get to see your son. I know that you've had a chance to connect with him over the read along, just like my mom has as well. But certainly, if we get Shree back, we will get him on the screen. Stefan is asking where my little elf is. Yes, she is sleeping. A funny story about the Santa outfit. I actually bought her a little elf outfit when we did this. We went up to Jersey. I drove her to for the holidays. I think it was Thanksgiving, and I forgot to pack pajamas. So I had to buy her pajamas at Target, and I figured if I'm buying her pajamas, may as well be an elf costume, and I may as well get myself a Santa outfit as well. Miriam is joining on the phone as well, so she'll be able to comment. Thank you, Miriam. Robin is joining us from upstate New York, and our friend Pragya is joining us from Silver Spring, Maryland, and Linda is joining us from Long Island. So again, thank you everyone for joining us. Thank you for sharing this with your friends. This will be the last show of 2020. We will take the Christmas weekend off and come back on December 27th. December 27th is when we're taking off. January 3rd will be our next show. And Apollo picked up on my don't feel bad for Shri, even though he's having Wi-Fi issues. And Rahadyan is joining us from New York as well. So before we bring Dr. Roy in, I just want to show you what's in the paper. So we will do that real quick. Turn on the paper cam, the New York Times cam. So here's the overview of what we have in terms of the various sections. The front page we'll get to in just a moment, but we have a really interesting business section focusing on the Bed Bath & Beyond coupon, which folks may be familiar with, at least in the States. This is an ubiquitous big blue coupon, great marketing tactic that Bed Bath & Beyond did. And there's also an interesting piece about no laughs in COVID-19. There's a British sitcom that is, I think it's called Pandemonium, that is trying to have a few laughs, which I think at some point we definitely need to. There's a special section in the New York Times, which we'll get to. Hang in there, help is on the way. A guide to the last months, what we hope are the last months of the pandemic. Hunker down at home, plan safer holidays, monitor your health, and look forward to spring. And we certainly agree with all of that. Hunkering down at home, planning safer holidays. What we could have had, and the image shows it very clearly, but we could have had a big wear a mask, which I know Dr. Roy will certainly endorse. It's in fact part of her name on Twitter. What else do we have? We have the at-home section, a new section by the New York Times. In January, I was actually at Amy Vership's house to launch the 2020 52 Places to Go. And of course, travel, obviously became not a focus for this year. So they shifted to an at-home section. What's interesting for this week is that they actually have, if you can see this coming off the paper, they designed it almost like wrapping paper. And this black strip over here, if you can see, is actually sticky. It's almost like there's tape coming off the paper. So very interesting. I've never seen anything like that before in the Times, this kind of design work. So hats off to Tom Jolly, Wayne, and Tom Jolly is the print editor, of course, of the New York Times, and everyone else who puts the paper out every day. The Sunday Review, again, interesting choice in terms of design. What is death? How the pandemic is changing our understanding of mortality. And the subhead, B.J. Miller on the Body and the Spirit, Noor-e Aziz Amna on long distance grief. But what an interesting graphic, just a color gradient for the cover. So we'll definitely take a look at that. Art and Leisure has a cover on Ma Rainey and an actor's last bow. This is an incredible movie. I watched it last night. Pam and I watched it. I wholeheartedly endorse it. Encourage you to watch. Viola Davis, Chadwick Boseman, incredible monologues, an August Wilson play. Couldn't endorse it more. Could not endorse it more. This is about a day in the life of a 1920s jazz singer, the mother of the blues, in fact, and the band that she plays with. Sunday Styles, left speechless. Let's review. The unsettling year produced new vocabulary and new uses for familiar words. So we'll definitely take a look at that. And of course, the book review, Agents of Change. This looks like it's a slave ship. Runaway slaves to Mexico and the road to the Civil War, The Kidnapping Club, Wall Street Slavery and Resistance on the Eve of War. And the New York Times Magazine, Catastrophes Harvest. This is about Russia and climate change. A little bit of glare from the lamp. Russia and climate change. So we'll take a look at all of those and certainly take a close look at the front page. There's certainly several COVID stories on the front page for today. But for now, we're going to bring on our guest, Dr. Lipi Roy, in just a moment, so we can talk about some of the developments that we've had on COVID-19 in both in terms of vaccines, but also the new strains that are appearing in the UK and in South Korea. We'll look at some of the policy issues involved as well. So with that, we're going to bring on Dr. Lipi Roy. Dr. Roy, thank you for joining us.
Hi, good morning, Neil. And I love the costume. I should call you Santa, right?
You can if you want to. I did actually play Santa once, years ago, for a youth group, full beard and everything. And I think I may have dressed up last year or the year before. I had a beard that for Halloween I used as King Neptune, but then I was able to use it for Santa as well. So
you're repurposing. That's brilliant.
Absolutely, have to do that, right? So as we ask all of our guests, and certainly you are, if anyone is a friend of the show, you are, Dr. Roy, joining us early on in the pandemic when we first started bringing on doctors to help explain what was going on, joining Shree's COVID-19 call several times. How have you been? What has the last 9 months now, going back to March, what has that meant to you? What has been your experience with the pandemic?
I mean, I think along with most people, this pandemic has just been so surreal for so many of us. And first of all, before I get into all of that, I just want to thank you, Neil, for producing this show, for the team, from Paula and so many other folks who've really worked extremely hard. And of course, the master, the king himself, Shree, his brainchild,
Absolutely.
Together globally, he and all of you have friends all over the world, and it's just been growing and growing. So thank you. This is a real privilege to be able to share these stories. So even though we can't be close together because of this pandemic, we can still use technology to connect. And I'll definitely be talking about the importance of connection from a health perspective.
Sure.
So thank you for asking the question. It's been just so surreal. 2020 in so many ways has been so painful and full of suffering for so many people. It's but it's also created opportunities where we never ever would have expected. And I'll tell you, certainly for me, it's been good and not so good in many ways. As with most people, I was in New York City right from the start, and we discovered very early on that New York City and New York State and the Northeast states in the United States were most heavily hit. And it's kind of shocking still to this day when I look at the COVID tracker, when I look at the number of cases and particularly deaths. I mean, early on, that high peak is really just in the Northeast. And the month of April was really a hellish month for the people in New York, for so many of my frontline colleagues, fellow physicians, as well as nurses, respiratory therapists, physical therapists, patient transporters, admin. I mean, I've said this multiple times that it takes a massive team of people to run a hospital and to take care of just one patient. So all of that's been pretty extraordinary. At least knock on wood, my own family, myself and my own family are okay from a health standpoint. I'm lucky. I have a roof over my head. I have a job. I have a couple of different jobs, actually. I have a wonderful family and friends and colleagues and a good support system. And these are things that, again, I'll speak for myself. Most of us, I think we just take for granted. I take for granted, right? This before the pandemic. And now when you see that thousands upon thousands of people, if not millions, if you think globally, are struggling to put food on the table, they've been evicted from their homes, so many other social and economic losses, not to mention those who've been directly or indirectly affected by the disease itself. This infectious disease, which can clearly be lethal. It can have both short and long-term effects. And these are all things that we're learning every single day. So in many ways, coronavirus and the COVID-19 pandemic has consumed my life as it has everyone else's. So, but I think I'm just trying to get through it day by day. So I think that's the best we can ask of anyone, Neil.
Absolutely. Thank you, Lipi. And in particular, your highlighting both the impact on regular folks in terms of, excuse me, the demand for food banks has been huge, but also the evictions. That's actually the cover story in the paper this morning, and we'll certainly get to that. I'd like to ask a question just to start off, and which is probably on the minds for a lot of people. The vaccines that have come out, Pfizer and Moderna. We see healthcare workers getting some of the first vaccines. I've seen family members who are doctors posting on social media. We've had some of our political leaders, not President Trump specifically, but Vice President Pence, Nancy Pelosi, Mitch McConnell, et cetera. Can you talk a little bit about the vaccines themselves for anyone who is questioning or concerned about the efficacy of these vaccines, the Operation Warp Speed, I think it was, or whatever the government name for it. One at Pfizer, I think, was outside of that structure, but Moderna was, if I have it correctly. Can we trust the vaccines? Should we get them? Should we wait? And how long will it take? How many people need to get the vaccine before we can feel safe getting back to somewhat normal activity?
Yeah, I mean, this has been the issue for, this has been on the minds of so many people, right? The vaccines, certainly in the scientific and medical community, we've been talking about this for months and months as kind of a glimmer of hope in the future. Well, that future is here now in the present. And I got to tell you, as a biology major, as somebody who did her graduate work in neuroscience and in physiology, and as somebody who's actually worked as a biomedical researcher for pharma before I pursued a medical career, I got to tell you, this is a scientific achievement, bar none. It is a tremendous moment in history to see not only one, not two, but we're actually going to have several vaccine candidates against this novel coronavirus. Mm-hmm. And I do understand, and thank you for asking these important questions about the vaccine. There is most certainly what we call vaccine hesitancy around these particular vaccines. And I'm not surprised. I actually don't blame a lot of people. A lot of the public think that, have this perception that we just started research on this vaccine last November, December. It's just been 1 year. But the reality is that we as society, scientists have been trying to develop a vaccine against a coronavirus. Remember, coronavirus is a family of viruses. They've been trying to develop a successful vaccine for years and years, almost 2 decades. So the current researchers have really been building off of that science. So, and then truth be told, when you put enough resources, money, power, manpower into a project, great things can happen. So to me, this is one of many lessons I hope that we are learning from this coronavirus pandemic. You put enough resources in something, we can solve a lot of problems. And it's not just about money, it's about willpower. It's if you have the will, you can accomplish anything. And my father, to this day, ever since I was a little girl to now, he says, Lippy, if you have a will, if there's a will, there's a way. So to drive me, to inspire me to accomplish goals. And so I think this is a tremendous scientific achievement, and to provide reassurance to all viewers about the safety first, and then I'll talk about the efficacy. The scientists have not bypassed any the scientific rigor. The clinical trial phases normally for drugs. Remember, a vaccine is a medication, and all medications have to go through clinical trials. Phase 1 and phase 2, and in large part, actually, or phase 2 and phase 3 happen in many ways concurrently. Normally, we would wait 1 or 2 years to do one, and then 1 or 2 years to do the next. Right now, we're in the midst of a pandemic, and we simply don't have the luxury of that kind of time. So certain steps were done simultaneously. They were not bypassed. So that's the safety side of it. And then on the efficacy side, these first two vaccines that are rolling out, the Pfizer-BioNTech vaccine as well as the Moderna vaccine, have been shown to have an efficacy of 94, 95%. I cannot emphasize to you how incredibly effective that is. So that means it reduces, if you get the vaccine, it reduces your risk of getting the virus or the transmission by 95%. Just for comparison, the influenza vaccine, the flu vaccine, which I get every season, every winter season, every flu season, has about 40 to 50% efficacy. Very few vaccines that we have an efficacy of 95%. It's really at the level of measles and chickenpox. So I just want to really reassure viewers and the public. And I think you're going to be asking me this question. If I've gotten the vaccine, I have not yet. Will I get the vaccine? When my turn is up, I will get the vaccine. I fully trust the science behind it, Neil.
Absolutely. Thank you, Dr. Roy, for sharing that and hopefully reassuring some of the folks who are watching. I don't know in terms of for our community how many people are vaccine skeptics, if you will, or naysayers. But hopefully this gives them some language and some background they can use with family, with friends, with others. And if there are people who are watching who do have their doubts, who do have concerns, please, heed Dr. Roy's words. Heed some of the insights she can offer. It's one of the things that we hope to do with the New York Times Read Along. It's not just about reading the paper. It's not just about the community, but it is also a public service when we need to provide that kind of information. Some great comments coming in that I just want to share. Arun Angzu, Roy Chaudhary saying this is an incredible and informative session. So thank you for that. There's some discussion about that section in the New York Times that had the strip on it, the at-home section. So we'll certainly get to that a little bit later. Dr. Roy Pradnyahalapur is emphasizing and absolutely want to recognize that. Linda Lawrence is saying that their high school closed after several students tested positive. They were at a big party last weekend with many other students. Selfish party behavior putting people at risk, and we saw that with Thanksgiving. Very high rates of travel and a big spike. We were expecting a spike anyway, and it just got worse. My wife was out yesterday before we went out to see some Christmas lights. The gas station was packed. I mean, there were lines. People were filling up and checking the air in their tires. We were concerned that people are planning long road trips to see family, which is, at least in my estimation, not the time. It's not the time to do that. Mom, sorry, we're not coming home for Christmas. And she knows that. We already had that conversation. That wasn't even something we thought about. It was just a no-brainer for us. Patricia was saying beautifully spoken, Lippy, so thank you for that. And our friend Stefan saying you're simply amazing, which we agreed. Ron Thomas calling you a superstar. And the comments just go on. So Lipi, if you get a chance, I certainly encourage you to check out Facebook and LinkedIn afterward to see if you can comment on some of these. One, I mentioned this earlier, and we'll go right there. Can you comment on the new strain that's hitting London? And I also saw last night a reference to a strain hitting South Korea. I think the one in London is spreading faster, but not as potent. The one in South Korea actually potentially has a higher viral load. Can you speak to those two real quickly?
Yeah, and thank you, Linda, for asking that question. I know it's been on the mind of many people. I was actually just asked about that for the first time last night and addressed it on air with Joshua Johnson's show. And for anyone tuning in, if you're interested, I'm going to be doing a Q&A on COVID-19 on Joshua Johnson's show tonight at 9 o'clock. So, and then you can tweet, I forgot what the hashtag is, but you can tweet questions and maybe your questions will appear. But I plan on answering a lot of questions, including, I'm sure, this strain. But I did talk about it last time for the first time. And so a couple of things, and by the way, Prime Minister Boris Johnson talked about it, as well as their Minister of Health. So it's definitely concerning a lot of people in the general population. So what we know so far about this strain is that it's moving faster, it's growing faster. However, there's no evidence to show that this particular coronavirus strain is causing more severe disease, nor do we have any evidence to suggest that it will not respond to the current vaccines that are out there. It's also important to remember that the emergence of new variants is actually a normal part of virus evolution. Virus variants come and go, they emerge over time, and mutations and genetic changes happen pretty frequently. Most of them really amount to nothing. So I think the important thing to remember, however, is that they're gathering data in real time, this minute, this hour, and kudos to the British surveillance, the UK surveillance team for detecting this strain. But I promise you, there is a lot of science and research and studies, data being collected right now. The key thing that I think they're looking for is making sure is to discover how it's affecting humans. What, if any, are any new clinical manifestations? Is there any change in disease severity? So these are the things that they're going to be looking for, Neil. And Linda, thank you for asking that question.
That's great. Thank you. And then there's also a question that Lisa had. What about the systems surrounding the vaccine? Follow-up, contact tracing, ongoing testing? Do you have any insights on that? Do you have a sense of, I mean, this is happening. It's a, you know, we don't have a top-down system in the States, right? A lot of it is being left up to the individual states, individual communities. And you see even in New York, disagreements between the mayor and the governor, which, you know, predate the vaccine, and they have their own political dynamic. But what can you say about the overall approach and the overall infrastructure around this response?
Yeah. So I appreciate Lisa's question. I want to unpack that in a different way. So let me start with the vaccine first. Many public health officials and health experts have always said for a long time that vaccines don't save lives, vaccination does, right? So rolling out vaccines, and we said this right from the start of this pandemic, really, is that rolling out the COVID-19 vaccine will be the most complex vaccination program in human history because we see the global impact of this pandemic. And that's redundant, by the way. Whenever people say global pandemic, that's redundant. So either say pandemic, or global outbreak. I even get caught in that too. So, but yeah, there's two aspects of it. Yeah, there's the actual scientists who worked really hard, long hours just to create this medication, this vaccine. So that's the scientific and research side of it. But then there's this whole other side of it, which is the actual rollout, which is the distribution, it's the shipping, it's the storage. And from what I've read, maybe a few $1 million. I'm not sure the exact amount, maybe 100 million, which may seem like a lot, but it's really 1 to 2% of the total funds that were devoted to the distribution and storage and shipping and like that aspect of it. The scientists did their job, and billions of dollars were invested in that part, but really a fraction was devoted to the rest. And again, if it's just a vaccine in a vial sitting in a box in a warehouse, that's not going to save a single life, right? So so we need, it's just, and these two particular vaccines that have rolled out, especially the Pfizer BioNTech one, poses a lot of logistical challenges in terms of the deep freezing requirements, right? The -70 Celsius, -94, I think, Fahrenheit. So that deep freezing requirement, and then there's, whereas the Moderna one requires, I think, -20, but then can be stored, once thawed, can be stored at refrigerator temperatures for up to 30 days. The Pfizer one, I think, up to 5 days. So these are like nuances that are really important, because you don't want to screw up at any stage, right? So because you want to make sure that the vaccine that you're actually inoculating into people is this not just safe, but it's actually effective and working. So that's the vaccine side of it. But well before the vaccine side of it, it was just a good old-fashioned public health measures, which are life-saving. And I think, Neil, you've seen me, and you and many of your viewers have seen me many times go on television and bring up the mask. It's my public service announcement, but this little cloth thing or whatever this fabric is actually saves lives. This is not Lippy's opinion. This is actually based on lots and lots of data showing that just this barrier prevents the transmission of the virus. And I always remind my colleagues, the nurses, the nurse practitioners, my team of people at Housing Works, and just everyone, remember how this virus works. It's transmitted through respiratory droplets through our mouths and our noses, but primarily our mouths. So that's why it's so important to cover both. Right? Cover both. Again, I'm not surrounded by anyone right now, which is why I'm not wearing a mask.
Sure.
A lot of reporters, they're wearing masks, especially when they're out in the field. They want to protect their cameraman, camerawoman. So just remember how it transmits. So now we have 3 public health measures to reduce transmission. It's the mask, it's the physical distancing, and now we have a vaccine. But remember, for the general population, this vaccine is not going to roll out until really middle of 2021. In the meantime, it's so important to wear that mask, practice physical distancing, Neil.
And Miriam's question, people who have received the vaccine should still wear masks, right? I mean, that's part of the issue, is that it's not going to roll out for everyone until the middle of the year at best.
Yeah, and can I just explain why that is?
Please.
People, even amongst my own medical community, like for other diseases, like say measles, say chickenpox, by the way, 2 vaccines that had about over 90% efficacy. You know, for this particular vaccine, again, for this virus, pardon me, we're literally learning something every day. While it's been known in nature, human beings are learning about this virus really over the last year. So, and one of the things that we're learning, at least about these vaccines, at least the 2 that are rolling out right now, Pfizer, BioNTech, and Moderna, the people who are vaccinated, it reduces the risk of disease transmission to them. However, we still don't know if that vaccinated person is still able to transmit the disease to others. In other words, forward transmission. Because of that, and because we don't know the duration of immunity or protection, for all of those reasons, it's still going to be really important to wear the mask, even if you're vaccinated, because you still want to protect the people around you. So those are the reasons, Neil, why it's important to still have that barrier with the mask. I can't hear you, Neil.
I apologize. I muted myself just for a moment there. Everyone is saying how clear your answers are and how effective it is to hear you explain these things. People watch you on MSNBC, on NBC News. You're a contributor to Forbes as well. Tell us a little bit about that, stepping away from the COVID-19 and the vaccines for just a moment. tell us a little bit about your life and your kind of professional career. What changes have taken place from March till now? When we had you on the show, and even before that, I think we had you on the show about a year ago, maybe longer.
Yeah.
And the focus was on your role as an addiction specialist, and from a professional sense. And I say this very very carefully and with respect to everyone involved. I mean, even for me, I'll start with my own case, right? With the pandemic, with everything going virtual, I was able to work with Sri to build up Digimentors and build up the live stream work, and leave my job at United Way to do this full time. And so it's been in that sense, I've been able to take advantage of the situation and benefit from that, even personally. And I always hesitate when I tell this story, but when I was working with United Way in Washington State, we had a mudslide in Oso, Washington in, excuse me, in 2014 that killed 43 people in 2 minutes. The side of a mountain gave way. United Way led the long-term recovery efforts. And although we would never have wished this on anyone in our community, from a professional sense, our United Way got much more attention, trust, credibility within the community. We had much higher media ratings and visibility. We were on the news constantly. So in that sense, there were benefits that accrued to us professionally as an organization. So in that context and with that background, your life pre-pandemic, post-pandemic, your
journey,
coming out of your journey as a media star. Can you talk about that just a little bit?
Well, first of all, I'm going to start with the end. You will never hear me use the phrase media star.
No, we will never hear you say that.
When people like Ron Thomas call me a superstar, I just have to laugh because I know I'm the world's biggest goofball, and my friends know that. So, but thank you for the question and for the opportunity to share my journey. Everyone's journey is unique, right? Even before the pandemic, everyone's journey is unique. So I don't know if many people know this. I've shared it with very few people, but so last year, let me just take a step back. Last year, I was working full time. I was I was a medical director for a state-run addiction treatment center in Brooklyn. I was also writing for Forbes, but I was also doing a lot of public speaking, mostly about the opioid addiction. Remember, that was an epidemic well before this current pandemic. So I spent a lot of my time doing a lot of public education, speaking at the intersection of addiction, pain, trauma, mental illness, homelessness, incarceration. These are all areas where I've had work experience, life experience, my own clinical training, all of these things combined. And so I discovered that there is a tremendous yearning for this information. And I'll be very blunt, we didn't really learn much of this in medical school. And so in my fellow physicians, very few of them really knew this type of work, other than the small minority that were trained in the field of substance use disorders, addiction, or psychiatry, mental illness. But even then, at the intersection of serving the underserved. So anyways, so I end up doing a lot of speaking, public speaking nationwide. And then I had my first international invitation. I was in Romania last October, 2019, invited to this conference, and it wasn't even a medical conference. It was called Power of Storytelling. So, but I bring this up because my schedule got so crazy in that I was almost every week, at least every other week, traveling to a different state, in addition to doing my 9-to-5 job. So I would be in clinics, seeing patients, putting in medication orders, talking to nurses, counselors, social workers until about, say, 4 or 5 o'clock. Then I'd catch a flight to, say, Phoenix, Arizona, arrive at maybe 11 o'clock at night, sleep overnight, wake up at 6, 7 a.m., pack my things, and then go to the venue, do my talk for, say, an hour, do Q&A, do other, answer other questions. And then I'd catch a flight back. So I'd often take a day off, but then I'd work on the weekends to make up for that day because I didn't have enough vacation days. I did that almost every week. There were times when I was in I remember at the peak of my craziness, I was in three states in 1 week. And this is where, as doctors, we're so bad. We don't heed our own advice. Here I try to tell people, self-care is so important. By the way, I then incorporated self-care into my presentations because I was asked about this by the audience. I raise this because by the end of the year, I could that kind of pace was simply unsustainable. I was clearly burning out. I was sleep deprived. I was under so much pressure to prepare these talks and do my day job and write for Forbes and pay my own bills and lead my own life. So I concluded by the end of the year, I made a conscious decision to leave full-time clinical practice and pursue part-time clinical, so maybe 1 to 2 days a week, and then for the rest of the time, really pursue speaking full-time and media as well as consulting, and then clinical part-time. And that was the plan starting January 2020. That was the plan. And then we all know what happens to plans, although I don't think anybody predicted the pandemic. So we started seeing, I think the speaking industry really started seeing it early on. We're some of the first people, the speaking industry and the hospitality industry, because those things are shut down really early on in February, March. And so I discovered that was not going to happen. And then the pandemic happened. And I think that's when I first started. I did the first coronavirus show with Shri early March. I remember because I was in Los Angeles at the time covering Oprah's Vision 2020 event for Forbes. What I was going to say is that what very few people know is that
March 1st
in March,
the show, in fact. Yeah.
Exactly. But at that time, Neil, I think very few people know that I actually filed for unemployment. So I was on unemployment for, I don't know, maybe a couple of weeks. And then to bring it around to when you least expect it, things, when one door closes, another one opens. God knows my mother tells me that all the time. And that's when early March, I received a phone call from MSNBC, a producer, saying, "Hi, Dr. Roy, I'm wondering, would you be able to speak this Saturday about coronavirus?" They weren't even calling it COVID-19 back then.
Yeah,
they were calling it coronavirus. And I'll be honest, I if it weren't for the opportunity to speak on Neil's show, Shri's show.
Shri show, not Neil's show. Let's be very clear. It's Shri's
show.
show.
I'm well aware of Shri's show. He was nice enough to invite me. And I'll be honest, I knew very little back then. Most doctors knew very little. Today we have 54,000 publications, scientific publications on COVID-19. Back then, I was essentially reading CDC guidelines, read a couple of papers to do Shri's show, that COVID-19 show, coronavirus show. And then that's what I had in preparation to appear with David Gura, who was the then anchor. And this is Saturday, March 14th. That was my first appearance on MSNBC. And I'll be honest, Neil, I thought that was going to be a one-time thing. I did, because I had appeared on CNN before, I had appeared on Charlie Rose before, Dr. Oz. These were all one-offs. And I assumed, this will be a one-time thing and I'll be done. And then later that afternoon, that same producer asked me back for Sunday, and then a different producer asked me back for Monday, and then Tuesday. And remember, each appearance requires a lot of work. I read, I prepare, and as I go along, I'll show you. This is a notebook, and I write notes every single day. I have this full of notes because there's just literally more and more information every single day. It's a lot of work. At least I put in a lot of time and effort to do research. And so after the fourth consecutive day, I finally asked the producers, "Hey, I'm honored to be on, but if I can formalize a relationship," and they're like, "Absolutely." Then their VP of talent called and invited me to be a paid contributor. And that's how that journey started with MSNBC and NBC News. It's been, and we can talk more about this, it's been such a whirlwind. It's been a real honor and privilege. The opportunity to have a national platform to talk about this. And I also try to talk about other things that interest me, right? The intersection of addiction, mental illness, depression, and isolation, which has been public health imposed. It's been a real privilege and a responsibility that I take very seriously, Neil.
Absolutely, and thank you, Lipi, for sharing that journey. I brought Shri back on as we were talking about it being Shri's show. I'm always happy to guest host and always happy to step in an emergency if need be. Shri had some Wi-Fi issues. Again, I'm not crying for him down in Puerto Rico, 80-degree weather.
Never mind.
But I wanted to bring Shri back and leave just with one question. If you can clarify, you made the comment that the news was calling it the coronavirus back in March. Can you just clarify one thing? Coronavirus, COVID-19, novel coronavirus, those are the three main terms that I've heard used aside from pandemic more generally. Can you explain the difference between those three? And then I'll give the show back to Shri and we can look at the paper together and go on. So thank you.
Well, thank you, Neil, for doing a great job. You're such a great producer and a great guest host. So thanks for raising that. It's in some ways such a simple question, but at the same time, people use these terms all interchangeably, and they're not all the same thing. So let's start with what we used to call, and still call, this novel coronavirus. It's a novel strain or a new variant of the coronavirus family. In the scientific and medical community, we actually refer to as SARS-CoV-2. So remember, there was a SARS-CoV-1, which we just called SARS-CoV before, which was SARS. But now we call it SARS-CoV-2. So if you look at actual medical journals, scientific publications, whether it be the New England Journal of Medicine, the Lancet, JAMA, all of these medical journals, they all refer to as SARS-CoV-2. But in the lay population, we really call it the novel coronavirus, which causes COVID-19. So back early on in the pandemic, I believe the WHO, CDC, they decided to call it COVID, which is coronavirus disease of 2019, because remember, we first saw it emerge in China and then Italy. I'm sure it was actually already here in North America. We just weren't testing for it. So I hope that answers that question.
Thanks very much, Lipi, and so great to see how well you've been doing and helping so many people through the crisis. I think telling us that at one point you had to apply for unemployment is sobering for a lot of people who think that if you have a great education, you have the most important, relevant, training and career at this moment, and you still felt that, and you're willing to admit it, especially in our South Asian community. It's not something we talk about.
Right. Well, exactly. And even to this day, I have relatives and other people in the Indian community, Bengali community, who are like, well, when is Lipi going to go back to being a normal doctor? Like, there's this idea, this perception that if you go to medical school and your residency and you're a doctor, that there's really one type of traditional role, which is you go to the clinic or you go to a hospital, and that's what being a doctor is. And again, I consider myself extremely fortunate to have the training that I do. I can really get a job. And frankly, one of our uncles in the Bengali community, after I graduated, I think I was still in medical school years ago, and he said to me at one of those Bengali parties, he said, Lipi, we're so proud of you. You bought yourself a lifetime of job security. And I didn't understand what he meant by that, but I didn't really appreciate that. Somebody who has my training can really get a job almost anywhere, anytime. So for the most part, so I do consider myself very fortunate that way. But yeah, I tried to pursue more of a non-traditional career path. I could have still had that job at the addiction treatment center or other places, but I really tried to pursue this other career path where I'm applying my clinical training, my clinical knowledge to educate and empower the public. I figure, what's the point in going through all these years and years of training if I can't share it with people? And so, and this, by the way, is not to discredit my colleagues who are in clinics, who are in hospitals, seeing patients, one patient at a time. I mean, that it's all important. We need all of it. And we need all of these people in all of these specialties, from primary care, obstetrics, gynecology, infectious disease, rheumatology. We need all of these people to be working and to doing direct patient care. By the way, the third job that I have right now, I have three now. One of them is once a week I go up to a harm reduction clinic in the Bronx, where I see patients, and I'm an addiction provider, a buprenorphine or Suboxone provider to one of the most underserved communities, not only in New York, but I would say probably in the country. So I'm very lucky, and I believe in paying it forward, Shri.
No, great. Thank you. And thank you for sharing that. Those who are not Bengali can experience a little bit of a Bengali gathering of uncles and aunties by watching The Namesake, the movie based on the Jhumpa Lahiri novel, where they have at least multiple Bengali gatherings in the movie, and you can get a flavor for that. All right, we are almost an hour into this, and we haven't gotten to the New York Times yet, which tells you something about how great Lipi's material is, the information she has, and the questions that people have. Folks, you're watching the New York Times Read Along. This is the 5th year of the Read Along, and this is our last show of the year, and we wanted to end it with a great guest, as we always have great guests. And Lipi was so kind to come back and join us. She is usually on a much bigger platform at NBC and MSNBC, but was very kind to be with us here today. So let's look at the newspaper. Neil's going to turn on the New York Times camera. I'm also going to bring on the PDF version so we can read that together as well. So Neil, let's go to the paper, and there you go. So much to talk about. I know Neil's gone through the sections already, so let's go to the front page, and I will also bring on the version that I have here so that you folks can see it. I'll just bring up first the full page. You can see here in color, including the ad at the bottom, and then let's go to the news. The lead story: Trump unlocks federal lands in a final rush for energy and mining projects facing protests from environmental and tribal groups. I started, Lipi, a Twitter thread called Because of Course about 2 years ago, of all the kind of bad things that the Trump administration is doing. And of course, they're doing this on their way out. Also, terrible great reporting is telling us about some of the terrible things being cooked up in the White House, including a discussion of martial law and appointing the lawyer who's been wrong on so many counts as someone to investigate the entire election. So things like that are happening as well. So that's here on the right side. You can see the Trump story. On the left, the story is on philosophy: Biden cabinet leans centrist, and picks have left some liberals frustrated. I don't know how closely you've been following the cabinet, but what do you think of the medical team that they have assembled, including our friend Vivek Murthy?
Yeah, it's so interesting. I mean, obviously, as you go through the newspaper, you're going to see a lot of politics and the interplay between politics and the pandemic. And, I often, there's various anchors on NBC and MSNBC and NBC News try to rope a lot of the health contributors, medical contributors into the politics. And I always try to stay clear that at the same time, politics in so many ways is impeding or impairing the efforts of public health, which is frankly why it just angers so many of us in the public health and medical world. Completely unnecessary. But regarding the Biden advisory committee, I mean, look, I don't need to tell your audience. If you just look at their credentials, their work experience, their life experiences collectively, it's extraordinary. And it's not just about what's on paper, but it's about what they've already been saying. They've already done tons of interviews, from Michael Osterholm to Vivek Murthy to Celine Gounder, many of whom already have tremendous public relations and communications and media experience. And of course, the scientific expertise to back it up. I'm very, very pleased with what I'm seeing with the Biden-Harris administration and their decisions so far. Neil, Sri.
Yeah, thank you. And this is another big story on the front page by a former India correspondent for the New York Times. Now she's based out of Massachusetts. When it's time for the tenants to go as evictions resume, a Massachusetts sheriff tries to soften the blow. This is so sad. You know from your work with your patients about how thin the line is for people in this country from having a life where they're staying above water and drowning. And that was in the so-called greatest economy that we've ever had, that the president kept telling us we had. And now things are so much worse. And as you said, politicians are making it bad as well at the kind of the worst possible time.
It's I don't even know where to start. It's so frustrating and angering. And if you just look at 17 million cases, which is really 17 million infections, 300 and I don't even know what the latest is, 315,000, 12,000 men, women, and children who've lost their lives. What's angering about that, and by the way, those are all underestimates. The CDC came out with data, published a report months ago showing that the actual numbers in terms of cases is anywhere from 6 to 24 times higher. So if because we're limited by our current testing capacity, right, which is far improved today than it was 5, 6, 7 months ago. But you know, if our current elected officials just listened to their health advisors from the beginning, including a temporary short-term, shutdown, stay-at-home orders like New York State had done, if they had simply done that in a coordinated national level, and if they had just say, hey, wear this mask, practice the distancing, just do that for now to protect each other and protect the most vulnerable. I'll be honest, Sri, the Trump administration would have been reelected. They would have, because the pandemic, while I think there are many other reasons why I think the Trump administration had done other egregious things before the pandemic, it's the handling, it's the gross mismanagement of this pandemic that I think caused them to lose the election. But look, at the end of the day, I'm a doctor, and what I would have wanted to see from the beginning, I'm still not seeing it from our federal leaders, is a consistent message and an evidence-based message to keep people safe. That's what's been the most frustrating out of all of this, Sri.
I understand what you mean. Mark says a Native American running Interior will be a major accomplishment, and of course a change as well. So much to talk about in the paper. Neil, I know you have the rest of the front section, so maybe we can take a look at that and see what else is in the paper. Neil's, I'm going to just move this onto the front page here. So there we go. We can take a look. So Neil, do you want to point out any particular stories?
Absolutely. So moving into the inside of the paper, I want to point out the Inside the Times story, and this is the story behind the story, my favorite section. It's about a virtual walk through history, a series of walks that Michael Kimmelin, the Times architecture critic, did 17 walks through New York looking at architecture. So we'll share a link to that in the comments, but that's always great to see the background. How did the project start? The walks just don't focus on architecture. They don't even mention the pandemic often in that series. So definitely check that out. Of interest section. So again, most of the content on pages 2 and 3 are not in the print edition. You can't find it. The Times, Inside the Times is. But the of interest, according to estimates by the Brookings Institution, based on background check data from the FBI, Americans bought 3.9 million guns in June, the highest single month sales on record. Just let that soak in a little bit. The highest single month sales record for guns right at the height of the pandemic. There are other tidbits. In Hawaiian, the word for salt is Parekh, meaning to solidify the sea. In 1861, nearly 90% of African Americans were enslaved, and most of the nearly 250,000 who resided in the North were disenfranchised. This is from the book review that we mentioned at the very beginning of the show. Many studies have been published that show knitting helps to manage chronic pain, improve cognitive function, and even increase happiness. And then there's also a piece about the Bed Bath & Beyond coupons. Bed Bath & Beyond started in 1971 as Bed and Bath, as a single store in New Jersey with lots of sheets and towels. Again, for those watching overseas, Bed Bath & Beyond has a ubiquitous coupon that they send out, and there's a whole story in the Sunday Business section about that. Other spotlight, the conversation, the sketchbook, a cartoon about penguins surrounding a vaccine that is on ice. So in the massive effort to deliver vaccine doses, small cold storage companies have the crucial role of keeping materials at temperatures as low as -94 Fahrenheit.
Let me just ask Lipi about the vaccine, and maybe you covered this already, but the admission by the head of the vaccine distribution program, the general, that there was a communication error. How could that happen? And is it something we need to worry about? Because already there are not enough of these, and then bad management is not something we can afford.
Well, I mean, there's been such mismanagement right from the get-go for this pandemic, but I read that, I think it was several months ago, Pfizer gave the United States the option to buy millions more doses, and for some, to this day, unexplained reason, they turned down that offer. And then you've probably heard about how the Pfizer has millions of doses just sitting in their warehouses, awaiting instructions from the U.S. government in terms of distribution and allocation. Just utterly inexplicable. But I mean, I've now talked to several of my fellow, not only medical contributors in the media, but just other fellow colleagues. Such gross mismanagement, and we've come to now realize that the federal leadership has just abdicated its responsibilities to the people. So that means the responsibility falls on local and state leaders to make the right decisions to keep their people safe. Beyond that, this miscommunication, I'm not really sure what the rationale for any of this is, but there are vulnerable people who really need this vaccine, from the elderly to healthcare workers, in order to keep people safe. Shri.
No, thank you. Let's go back to the New York Times camera and see what else is in the paper. This is the tracking an outbreak section that they've had now, sadly, all of these months. Winter descends, a dark, bitter echo of our past. And Neil, call out anything that you'd like us to know.
Yeah, of these 4 photographs, the cut line, the darkness of the days are real for me, and the darkness of the pandemic is very real to me. Dr. Michael Osterholm, a member of President-elect Biden's COVID task force. What a combination, both in terms of the pandemic, but also for seasonal affectiveness disorder and people who are cooped up at home. I mean, all these things, the mental health aspects and the toil, the impact is incredible. And I think that, one thing that I read, which is obviously very relevant for me, is there was a comment somewhere, I think I saw it on Twitter, when your child is frustrated about their computer not working or their mouse not working, and they really express that frustration. It's not about the computer, it's not about the Google Classroom site that's not coming up. They're expressing the frustration that we all feel, that we've all felt for the last 9 months. They just express it in different ways, and it's something that we need to be mindful of. This is a continuation of the eviction story on the front page when it's time for attendants to go. Again, another incredible story in the middle of the pandemic. And now what's interesting, again, we have to always take a look at the ads as well. Moderna with a full page ad in the New York Times. We've been at this for 10 years. Our platform, mRNA platform, Dr. Roy, would you please translate? That's
messenger RNA. Yeah.
Messenger RNA, exactly. Platform is a modern approach to medicine, but it's just the beginning. So very interesting. And I think that's an important point as well. You made a great point earlier in terms of the research behind the vaccines and the faith that you have in the scientific process that brought us here. My understanding is it's not that they started working on the vaccines in March or in April when they realized, oh, wait, there's a pandemic. We need to try and figure this out. This is something that these companies have been working on for a number of years, and they maybe kicked it into overdrive over the last several months. Is that correct?
Yeah, and you're absolutely right, Neil. And this is where I hope that we are learning lessons from this pandemic. If we just devote the time and energy and the resources and the finances and the manpower to other problems. What about malaria and tuberculosis and HIV/AIDS? We don't really have successful vaccines for any of those, and yet people are dying every day from those diseases. What about really making a concerted effort for women with ovarian cancer or fertility issues? What about men with prostate cancer? I'm saying that there's so many other issues that we have not really fully tackled because, frankly, in the United States, they don't really prioritize health. Where does the money go? Really, if you think about it, money goes to the military and financial organizations. I've said this on air several times. In 2019, Congress appropriated, I think, $685 million to the Pentagon, $2 billion to emerging disease and pandemics. 685 versus 2. I think I might have the numbers a little off, but the point is that they're off by a lot. The discrepancy is tremendous. So
sure.
If we just continue doing this, we would really make more of an impact on more people.
Here's an article out of Pakistan. Public apathy and conspiracy theories are feeding a second wave, which is certainly disheartening. And then out of London, as we discussed earlier, new variation of the virus pushes the London area into a harsher lockdown.
And President Trump tweeted, he's friends with Boris Johnson, but he's pushing that as an example of where where Biden would go, and talking about that. This is a funny / unusual story out of Rome about a nativity scene that was in the Vatican that are just very unusual examples of the nativity scene, and so that's an interesting story.
In astronaut costumes,
yeah,
the little figures. What's interesting, there's another full page ad from Chewy, which is for pets.
It's like an Amazon for pets, yeah.
Amazon for pets. You could probably appreciate this. 'Twas the year our pets saved us, a Chewy original poem. And I know a number of people who actually got pets during the pandemic.
The key is that we need them to keep the pets after it's over, because there's a problem they talk about the Christmas puppies and things like that. So we don't want the pandemic puppies to be returned at the end of this.
And here's another major story around coronavirus. About how China censored the news, halting the spread of negative news, how China censored the coronavirus. But just look at the layout. It's great online as well. But you have this very interesting graphic of the coronavirus with eyes in the middle. But then if you look closer, the extensions of the coronavirus are also eyes as well, if you can make that out. And then they have translations. They have excerpts of memos translated along the side in Chinese.
Meanwhile, Vanita JD and LLM says she's an admirer of Dr. Lipi Roy. That's China story, by the way, is really big, and people should definitely look at that. Just want to do a time check, folks. It's 9:45. We're talking to Dr. Lipi Roy, who you're used to seeing on NBC and MSNBC. She's kind enough to spend some time with us today. Feel free to ask her any questions. And at the same time, we're looking at the New York Times. We do this every Sunday, where we read the New York Times at 8:30 a.m. Eastern Time. So hope you'll join us again for future episodes if you're a newcomer here. We've been doing this for 5 years, and it's been just such a pleasure to build this global community around this. And
we should also say that she's with us today via special dispensation from MSNBC and NBC News. So thank you to our friends at MSNBC for letting Dr. Roy join us. This is was a unique opportunity to let her join the show. So thank you for that.
Yeah, huge. We're so grateful. Yeah, because once you're on one of their platforms, they want you to stay there, and so this is a rare dispensation, as Neil said. So what is this ad we're looking at?
Ad is another ad around coronavirus research. When the world needs a miracle, you start by solving the impossible. This is from Metadata. Metadata.com. Creating a COVID-19 vaccine in less than a year seemed impossible, which contradicts what we were saying earlier, that it wasn't just a year that they were working on it, even for an industry familiar with long odds. But because of the ingenuity of our life sciences community and the courage of more than 1 million clinical trial volunteers, what could have taken 10 years was done in under 10 months. And countless lives will be saved. To all of our colleagues in life sciences, we thank you. So a general thank you.
So what is the ad from? But what's the organization that?
Metadata is the sponsor of the ad.
I don't know what that is.
So it's an interesting.
That's the kind of ad you see, like Pharma USA or some group like that. Let's keep going. We have lots of parts of the paper.
These days, buses bring school to the students. This is an issue of Wi-Fi. Some school districts are having to bus Wi-Fi access to neighborhoods so kids can do remote learning, which is, this is, buses have been a lifesaver for Heather North. She and her children accessed the Wi-Fi from Loomis Park. And Becky Wood, a teacher, doesn't know if her middle school students are at home, in their cars, or at a picnic table during social studies classes.
Imagine in the winter, Neil, that's even a bigger problem. Right? Yeah.
In the winter, and if nothing else, the whole virtual school remote learning put in stark relief the digital divide in this country, and the access to broadband internet, the access to hardware, having laptops, having tablets that kids can use. The school districts that can distribute those resources and school districts that can't, we're going to see a big impact long term in terms of how this impacts education, not just for kids who are learning remotely. But the rest of the front page, certainly a number of interesting stories. This is one on the Trump administration unlocking federal lands in a final rush before they leave office. Several articles about Biden's climate change team. And then a last, again, a full page ad. No matter what school looks like, we're connecting students and teachers to learning.
Let's ask Lipi about schools reopening. We're seeing people complaining that school positivity rates are not as high as some other industries where those facilities are open but schools are closed. Where do you stand on, like, after we go through the Christmas, New Year season? Where do you stand on this?
Yeah, I mean, honestly, Shri, it goes back to my message earlier, which is the frustration that most public health folks have been feeling with the lack of a national plan, a national strategy. If they get not only come up with a plan, but also the funding and the resources to roll out those policies, then all schools in all parts of the country would be able to be open safely. Just as a reminder to everyone, schools are not just important for education and the development of children, but also they provide 20 million meals. They provide health services. There's so much more that they provide. So, but yeah, it's possible to actually have in-person learning if you have the right tools in place, whether it be masks, having the desks apart, having a good ventilation system. I mean, it's all doable, Shri, if you have a good plan that's consistent from city to city, county, state to state. So.
All right. Well, we're crossing our fingers and hoping people make the right decisions, federal, state, and municipal, and then at the family level, right? Not everything works for everybody, and we need to be very aware of that. Here's the section here that Neil's going to show us.
This is a special section, Shri, in today's paper. It is also available online. Tom Jolly, the print editor of the New York Times, gave us a heads up on this. A special section, hang in there, help is on the way. We took a quick look at it at the beginning of the show. A guide to the last months of the pandemic. We hope it's the last months. I assume that's where the we hope is referring to. Hunker down at home. By doubling down on precautions, you can help slow down the virus. Plan safer holidays. How and when the pandemic ends will depend on our choices this winter. Monitor your health. COVID-19 can be scary, but we've learned a lot about how to treat it, and look forward to spring. With the rollout of new vaccines, an end to the pandemic is in sight. So we just want to take a quick look at this. This is, again, the content is available online, but it's always great to see how they lay this out in very big font and with specific underlining. This is an interesting design choice. So times are tough now, but the end is in sight. If we hunker down, keep our families safe during the holidays, and monitor our health at home, life will be better in the spring. Now, I don't know if you can tell in terms of the resolution. I think you can just barely make it out. Hunker down is highlighted in a
we see the different colors.
Magenta color. Safe during the holidays is almost a yellow. Monitor our health is a green. Monitor our health at home, and better in the spring is more of a blue. I think the colors could be a little bit more have a little more contrast, but underneath each word. And that's really small print, page 4 for hunker down.
So it's like almost like a digital table of contents, but in print.
It's
so
a
that's
print.
Like the merging
Exactly.
of the two.
Exactly, which is really interesting. There's an intro by Tara Parker Pope that goes into detail about this section. Our Well columnist, Tara Parker Pope, collected the work of multiple Times journalists and her own reporting in compiling this section. I read this article, when can we start making plans again? Asking experts, including Dr. Fauci and Times reporter Donald McNeil, and a number of cautious epidemiologists to see what they had to say. The general feeling, my recollection was that until we have 70% of the population vaccinated, it won't have a critical mass that we need to get back close to normal, and that most people we might be wearing masks for some time to come, even if we do start going back to restaurants and movie theaters. But you need to get up to that 70% level, and with all of the doubters around the vaccine, and not even, there may be people who are doubting it. They may be convinced, but there are people who are never vacciners, if you will. And the question is, how many of those folks will get vaccinated? Will enough of them be convinced? Hunker down a little longer. This is interesting. So the full 2-page spread, that same red kind of theme, nice graphic in the center, and then red underlining throughout the section. Choose a mask with 2 or 3 layers that fits well and covers your face from the bridge of your nose to under your chin. So again, from a reader's perspective, that captions get people's attention, subheads up here, pull quotes like this is Dr. Fauci, but I've never seen them underline specific sections in a color like this. So that's really, really interesting. So when you go through similar, these are all, and the other thing, Shri, these are also designed, although you would lose the back page, if you want to highlight one of these centerfolds. You could actually use this as a poster. Scale back your holiday plans, right? Again, that graphic, some yellow underlining in various parts of the page. Another quote from Dr. Fauci at the very top. And then this one in green, take care of yourself at home. The underlining, we're getting better at COVID-19. We've learned a lot. Pay attention to days 5 to 10. So this is if you actually get COVID-19, what you should do. Get a fingertip pulse oximeter, a timeline of symptoms. I will say that I saw on Facebook yesterday, a cousin of mine shared that she had gotten COVID-19 and shared her experience with the virus. It was a mild case from what I could tell out in California. Another quote from Dr. Fauci in the top right corner. And then this last section, look for better days this spring. I think many of us may want to jump ahead to this section and really just focus on this, but this is a full 2-page section. A record-breaking vaccine is on the way. The challenge is ahead for widespread vaccination. Hoping vaccine skepticism will fade. Some of the themes we've been discussing today. Answers to some of your vaccine questions. What the future looks like to 700 epidemiologists. And now a final word from Dr. Fauci. So I'd been noting that his poll quote had been the top, but it looks like this is a Dr. Fauci special section. There's how vaccines are approved. It's a smaller font, which is interesting. I would almost thought you could make this bigger just to make sure that people didn't see it, but they have the steps, the preclinical testing, safety trials, expanded trials, efficacy trials, approval, and what happens when you pause a trial, because we saw some headlines about trials being paused. And this is Dr. Fauci's.
Yeah, we see a question here about the vaccines for Dr. Roy. Can you please talk a little bit about various ways to build trust in vaccination? We at Action Global Health Advocacy Partnership work to mobilize resources for vaccination and ensure equity.
Yeah, the anti-vaxxer movement existed well before this pandemic, and it seems to be just picking up even more steam. It's perplexing to me, Shri and Neil. I don't really get it. I'm very honest with my own personal story. I get the flu shot every winter. I'm all vaccinated up. I mean, given my international travels too. So if there's a vaccine out there, I'm pretty sure I have it. Hep A, Hep B, and obviously tetanus, diphtheria. But you've already talked about this misinformation campaign, and it's just so. That's unfortunate. But I wish people that are trusted individuals, not only in public health, but just local leaders as well. I think that's how we're going to be able to really educate and empower marginalized communities of color, identifying people that are trusted and knowledgeable in their community and partnering them with other trusted people in public health. Nurses, by the way, are the most trusted profession in the world. So partnering these individuals and then maybe identifying celebrities that are respected and admired, whether it be a LeBron James or a Kevin Hart, whoever. So it needs to be a collaborative approach, I think. I think that's the only way to combat the misinformation by not just anti-vaxxers, but even those that are just on the fence and that are unsure.
Thank you. And folks, we just want to remind folks that at 11 a.m. Eastern, our friends Dr. Sujana Chandrasekhar and Marina Kurian host a terrific show called She's on Call that runs every Sunday. So please join us for that. I have the honor of being one of the executive producers, and they're talking about COVID-19 and so much more with Dr. Teresa Chappell and Dr. Lauren K. Shawn. So please join us at 11 a.m. Eastern on all the social media platforms. For She's on Call is the handle, and you can also, I will also be retweeting it. So please follow them, and they've also been guests on the New York Times Read Along in the past. And we just have a little bit of time left with Dr. Roy. We are just going to look through some more sections of the paper, and Dr. Roy, jump in if you have any thoughts on any aspects of this. I also do want to see if we have time, there is a wonderful recipe in the New York Times Magazine about cooking chicken in Mumbai. And this is a review that, as we scroll through this, we'll get to it. But it talks about the importance of Christmas in India. And in the letters to the editor after this, in the comment section, we noticed a lot of people saying, "Oh, they didn't know they celebrate Christmas in India." Not just Christians, but it's one of those holidays that are celebrated by lots of folks. It's really good. What are we looking at, Neil, in the cover and some of the sections?
So for the cover of the magazine, and I'll just get the glare off, it's Catastrophes Harvest. Climate change will make the planet's coldest regions more temperate, arable, and populated, and no nation stands to gain more than Russia. So the impact of climate change on Russia, which is interesting. So that's what this cover story is. And then inside, in addition to the Russia story, this is the stories are about Frederick Weissman's patient immersive documentaries have shown American institutions at their most frightening and their most noble. Reality exists in those ballots. Piece when Donald Trump's campaign tried to overturn election results, one Republican election official found himself, opposing the president. And then another piece, Emerald Fennell, pictured here, first film, promising young woman brings macabre feminist wit to experiences that no one wants to talk about. Wow. So I want to, and the description of behind the cover, this week's cover story is the third installment of a 2-year collaboration by the Times and ProPublica on climate migration. The photograph of a snowy soybean farm outside a Jewish autonomous region in Russia highlights how, as the planet continues to warm, the country's current desolate climate will transform, creating a prosperous and habitable landscape ideal for the millions of people who migrate farther north. So sending someone to Siberia won't be as bad as it used to be, I guess.
Can I just add that climate is yet another example of a topic that's really been politicized. This pandemic has shown that issues that are in many ways health issues are being politicized. COVID-19, climate change, gun violence, and I think the onus needs to be also on doctors to really speak up and not to quote stay in their lane, but really inform public and policymakers and politicians and elected officials that these are all health issues that are directly impacting the health and safety of the population.
So I also just heard a phrase that I had not heard before, even though I've lived in the Soviet Union. And you said the Jewish autonomous region, and this was a place that had at one point 25% of the population was Jewish, and now it's less than 1% or even smaller than that. And yes, it's still called that.
It's actually, I skipped over the Russian word I couldn't pronounce, Shri. BIRO, Bidzhan, so Bidzhan, Jewish Autonomous Region, which makes me assume that there are other autonomous regions. It's not just the singular Jewish Autonomous Region in Russia, but that is an interesting point.
Yeah, this is something that I hadn't seen. So if you can find the food section as we go here, and we're just going to talk to Dr. Roy while you find that. So Dr. Roy, there are a lot of people who missed the beginning of the show who may rewind, but they may not get a chance. Tell us, what are you looking forward to in the next few weeks that tell us the vaccine program's on schedule, and what do you say to people who, like me, may have gone on to the tracker sites for when we could be in line and we see 180 million people ahead of us and we say, oh my God, this is never going to get to me?
Yeah, and I think, isn't the New York Times, they had this kind of calculator algorithm, and even Dr. Fauci himself was number 300 and something thousand. He has since been moved up, but somebody who's 79 years old, and and works in this field. But anyway, so yeah, You're absolutely right, Shri. For the general population, it's probably not going to happen. The vaccines are not going to be rolling out for them until mid of next year. But look, this is why I have like mixed feelings with the vaccine. On one hand, I'm extremely proud and amazed that this is such a scientific achievement to have these vaccines, multiple candidates available. But on the other hand, I'm so disheartened and frustrated and angry that so many lives have already been lost. Lives are currently being lost. All these people are being unnecessarily hospitalized because people aren't, to use the expression that the word that Neil just read in the newspaper, they're not hunkering down. And we've been giving the same message of wearing the mask and the distancing for many, many months now, Shri. At this point, I think this should have happened months ago, it needs to be mandated. And this is not an infringement on civil liberties. If you think about it, we already have limitations on our individual liberties. I can't just drive 200 miles down any road. I have to wear a seatbelt. I can't just I don't have a water bottle in front of me, but I can't just carry my water bottle through airport security. So, we already have these laws, mandates in place to keep all of us safe. The same thing needs to happen with the few public health measures that we have. So I think if people just do that and avoid being in close contact, congregation with people, that's what's really going to keep people safe. So again, we have 3 preventive health measures. We have the masks, we have physical distancing, and now we have the vaccine, which will eventually be rolling out to the general population. So I think with all those 3 measures in place, and if people practice them, we can really contain the pandemic in the United States, just as other countries have successfully done. New Zealand has actually declared that they are virus-free. Countries like Canada, Germany, Iceland, many other countries are doing a far, far better job than the United States, which is unfortunately has taken a politicization route, Shri.
And that's really something that we all hope we can be New Zealand. They have a great female leader there, and we know that her leadership has made a big difference there. I mean, some of the other stats just to remind people that some countries like Japan have had fewer deaths in the entire year than we had yesterday. I mean, shocking statistics like that. And then a reminder to everyone who wants to fight for liberty that people fought against the seatbelt laws when they were introduced by the Reagan administration because they felt it was against their freedom, and now it's accepted. So if there are things that will keep us safe, let's do what we can. And we like the hashtag that nurses and others are using. This is our shot, right? Like, this is our last chance really to fix this after having lost so badly multiple opportunities throughout the year. As you said, if the Trump administration had done the bare minimum, he could be president again, but he did not. In fact, he did the opposite every single time. I'll just show you as we wrap up here. I do want to remind folks that I have a weekly newsletter that goes out on Sunday mornings. It should be in your inbox if you already subscribe. If you don't, I hope you will subscribe. srinet.substack.com, srinet.substack.com. I love this picture from the soup Nazi. Someone really had some fun with this. And so I said the good news is there are 31 days till President Joe Biden and Vice President Kamala Harris. The bad news is there are 31 days for Trump to do a lot of damage. And our topic today is about media diversity, but just shows you there's so much that we need to worry about and think and talk about as we go into this new year. What a year it's been for people, 300,000 plus dead folks. America has 4% of the world's population and something like 20% of the world's debt. That proves there's something terribly, terribly wrong in the way we handle this, and a really tragic. You remember that moment earlier this fall when there were countries that had fewer cases than the White House, just because, and that's just funny, but also sad and tragic. Also, you saw the story of one of the White House security folks, not a Secret Service agent, who had to have his own GoFundMe. A poor man lost his leg, his leg was amputated, And this is a country where we have things like this, where somebody works at the White House has to have a GoFundMe. That's how bad our healthcare insurance system is. And as a doctor, I know you think about a lot of these issues.
Well, I mean, I think all three of us that are like, I see you, Shreya and Neil. I know we all have friends and relatives around the world. I am getting messages. I have been for the last 8 months. They're like, Lipi, the United States, it's the richest country in the world. How is this happening? I mean, they're literally perplexed. And for the wealthiest and most resource-rich nation to be going through what we're going through, it's just a testament to the colossal failure and the importance of leadership. This is why leadership matters. Coming up with a plan and policies that are driven by data, by science. It's just this current administration, and it's not just one man, by the way. It's all of his followers. It's his enablers, right? The Jared Kushners, the Ron DeSantises, and many other people that have, frankly, just because of their inaction, led to really murder. It's just as clear as that.
Sure. Fernando is asking, could you speak a little bit about Christmas in India? And this is Nick Sharma's series of recipes in the New York Times Magazine, and he says a chicken dish that makes it feel like Christmas. When he left Mumbai for Ohio years ago, he had to leave his family's holiday celebration behind, and now he has a recipe that's from Goa and might be from Mozambique originally. I'm not even sure how to pronounce this. If we go up, we can see the name. It's the name of the dish itself. It's chicken. It's a chicken dish, and there it is, kafrial maybe. And let's take a look at what it looks. It looks really good if you're a non-vegetarian, of course. And he talks about how his family would cook, make a big deal out of Christmas. And Fernando's asking about Christmas in India. There are about 30 million plus Christians in India. And in the state of Kerala, where my parents live, Christianity came very early. St. Thomas is supposed to have come to Kerala in 42 AD. That's only 9 years after the death of Christ, and brought Christianity to India. And so this is the recipe here that you can see. And Nick has done other posts as well about various. So I like the ending of this, and there's a good way for us to think just that paragraph. In the years that have passed, I've been able to celebrate Christmas with my family, but once again, I won't see them this year. So I'll make a lot of the same dishes they do, including a big pot of chicken kafrial, adorned with those crispy potatoes, roasted rather than fried, along with rum-drenched fruit cake and a video call. I think for a lot of us, that's what Christmas and this holiday season is going to be. New Year is going to be the same way, but we are just grateful for all of us who have been able to survive this crisis, thanks to great doctors and nurses and scientists who have told us what to do, as well as doctors like Lipi Roy, who have given thousands and millions of people accurate, correct scientific health information. We are so glad you're doing that. And please follow Lipi. She's at Lipi Roy on Twitter, and her Instagram game is also very good. She's at Dr. Lipi Roy on Twitter. And so we'll give you a chance to give us some final thoughts, and then we'll go ahead, Neil. Do you want to jump in?
Before we do that, I just wanted to say about Christmas in India that, you know, one of the things to understand is how Christmas has become such a cultural touch point, that it's not just Christians who celebrate Christmas. And, you know, for the Indian immigrant community coming here, I mean, my parents introduced us to Christmas. I think it was even, I'm not sure about my older cousin, Devin, but when I was here in the 70s, early 70s, it was the Christmas lights. It was to celebrate, it's kind of the cultural aspects of it, as opposed to the religious aspects. So I know in India, people exchange gifts on Christmas, even if they're not, it's not a religious occasion.
Not everybody, but yeah, they certainly mark the holiday. Depending on where it is.
And of course, for many people, it is a religious holiday, and we should not forget that as well.
But I agree, Neil. I mean, I was born and raised in Toronto, and Christmas is something that my family adopted very early on. We had a Christmas tree, we exchanged gifts. So we never went to mass, but we celebrated the I guess the more cultural, maybe commercial aspects of it, but we went to our own temple, did our own temple stuff. But I just want to, Sri, I just want to say thank you so much. Yeah, Twitter's at Lipi Roy, but it's confusing. On Instagram, it's
Lipi
at
Roy
Lipi
MD.
Roy MD.
Sorry about that. Yeah,
Before
thank
we
you. Yeah.
leave you, Lippy, we have a question from Ellen Austin. She's really curious about the Moderna vaccine and the efficacy for people over 70. If you could speak to that.
Yeah. So really good questions. So what's interesting is that they've tested the vaccine. I think there's a difference. The Pfizer BioNTech is one of 16 and above, and Moderna is maybe 18 and above. I think it's still safe for people that are 70. I think I can't remember the age cutoff, but it definitely includes people in their 70s. I can't remember if maybe the oldest was 90, 95, but it's certainly safe amongst the elderly. I'd have to check back to see the Moderna information to see what the oldest age is. But these vaccines are definitely designed for our most vulnerable as far as the elderly and people in nursing homes.
Great.
Thank you.
Thank you very.
Thank you for answering all of these questions. There's still lots of comments coming in. Sujana Chandrasekhar, Dr. Chandrasekhar, who's co-host of She's on Call, who says, we have a Nataraja, that's the dancing Shiva, on top of her Christmas tree. We had a Christmas tree every year growing up, where I did with my family around the world, even though we're Hindu. And Debbie says that Lippy is a great cook too. She posts food photos on Facebook.
I do all the time. I love food. Food is
Shri, in terms of the holidays, Hanukkah just finished. Last Thursday was the last night of Hanukkah, and we've actually lit Hanukkah candles in the past as well in our house at Emily's request. So it's a nice tradition here in the States where. And seeing more references to winter holidays, I've seen cards and advertisements referencing Diwali, Hanukkah, Christmas, Kwanzaa, solstice, happy vaccine coming in 2021. So it really is, it's that whole question of season's greetings, happy holidays versus just saying Merry Christmas. It really is season's greetings and happy holidays. And thinking back to next week, if we didn't wish our friends a happy Hanukkah for those who are celebrating last week, our apologies, but certainly hope that your holiday season, which is now over for people who are Jewish, was a good holiday season as well.
Dr. Chandrasekhar says, seeing pregnant women getting the vaccine. Comments, Dr. Roy, on your way out.
Yeah, so great question. I would encourage people to follow my former medical school classmate, Jennifer Lincoln. Dr. Lincoln is a obstetrician gynecologist. Follow her on Instagram. Her posts, information are so spot on. She's creative, she's funny, and she's very informative. And in one of her posts, she talks about how several leading organizations that oversee and drive a lot of information for pregnant women, including ACOG, the American College of Obstetricians and Gynecology, as well as the Society for Maternal Fetal Medicine. There's like 4 organizations that all really encourage vaccination. However, they recommend that pregnant and lactating, breastfeeding women talk to their doctors and to make a shared decision as far as what's best for that particular woman. So, so it's not true that the vaccine's not safe, but you need to have that shared decision making between the doctor and the pregnant women before moving forward.
I was just going to ask what the URL is, and look at our wonderful producer, Paula Kiger, has put in Dr. Jennifer Lincoln on Instagram.
Paula's the best. Paula's just a rock star.
And Dr. Roy is at Lipi Roy MD on IG and at Lipi Roy on Twitter. So please follow them. Ellen saying thank you, terrific as usual. Neil, we are taking next Sunday off. So yes, we want to give wish everybody the very best for this holiday season. And if I missed it in the beginning, I just want to remember Neil's father. It would have been his birthday this week, and Neil's father not only was a wonderful friend of my family and of me. I knew him before I knew Neil. And the reason we do the read along, the reason Neil got involved in the read along is because he has a lifelong love affair with the New York Times, the print New York Times, thanks to his dad, as I do thanks to my dad. And when he passed away, his father, who was a lawyer and a publisher of an Indian newspaper, asked to have the print Sunday New York Times, all of it in the, he asked to be cremated with it. And I get goosebumps every time I tell that story. Neil lets me tell that story, and we're thinking of Neil's father and his entire family, and his mom, Sudha, who's a wonderful supporter of this show as well. So thank you to your dad for all his legacy continues. And Makran says his father's birthday is today.
Oh, wow.
And
yeah, today was
Debbie
the actual
says,
day. December 20th. This was my dad's, would have been my dad's 77th birthday. Wow. I'm going to take the occasion, Shri. I appreciate you sharing the story.
Parekh, we're thinking of him.
I appreciate you sharing the story of him asking to be cremated with a Sunday Times. I'm going to take personal privilege, and I'm sure Dr. Roy wouldn't mind. When he passed away, when I spoke at his funeral, the centerpiece for my remarks was to encourage family members, to support family members who are trying to kick the smoking habit. My dad smoked for 50 years. He quit smoking when he died. That's how that led to his death, and that's something I feel very strongly about. It's not easy. It's an addiction, as Dr. Roy knows. So for anyone, if you know anyone who has quit, congratulations, thank you, keep it up. For anyone who's trying, please support them. Please do everything you can to help them get healthy. That's my plea for you at this holiday season.
Thank you, and thank you very much, Lipi. Very grateful to you. We want to thank our team that helps put this together every week. They're just awesome. Neil, of course, as our executive producer. With Paula Kiger and Steve Taylor, Carla Baranauckas, and Julia Weeks. We're grateful to all of them, and to our sponsors. We're thankful. Oh, there they are, at Big Green Pen on Twitter, at Julia L. Weeks, at Steve DeReeve, at Kabara, at Neil Parekh. Please follow all of them, and a big thank you to our sponsors. We want to thank our friends at Muckrack and at Strategy Focus Group. Please check them out. And if you'd like to be a sponsor in the new year, wouldn't that be fun? Reach people around the world who care about factual information. Please email us. You see our emails online on screen right now, and we'd love to have your support. And with that, let's thank Lipi for an amazing morning. There she is. I do have to ask her to tell us, I know what an MD and an MPH are, but tell us what FASAM is.
Yeah, so well, Neil just mentioned the addiction medicine and cigarettes, and I thank you for that PSA, Neil, about tobacco. If I can just add that, the opioid crisis, everyone was talking about that, but alcohol kills more people than opiates, and tobacco, specifically nicotine, kills more people than opiates and alcohol combined. And many of my patients say that quitting smoking was way harder than quitting cocaine, heroin, or alcohol. So I agree. Wow. We all really hard, and you can kick the habit, you really can. Yeah, FASAM is fellow of the American Society of Addiction Medicine.
Great. Well,
awesome.
Thank you,
well,
Dr.
Thank
Roy.
you for all you do. Really appreciate you.
Thank you both.
And with that, happy holidays, everyone. Happy New Year. Merry Christmas if you're celebrating. And we'll see you in the new year. Thanks very much, everybody. And you can find all our archives on youtube.com/3net. And there's a beautiful playlist of all of these shows. We've had an incredible run this year, including the print editor of the New York Times, the chief White House correspondent of the New York Times, Washington, D.C. correspondent of the New Yorker, Harlan Coben, who had 3 Netflix shows on at the same time while #1 book on the New York Times bestseller list, Matthew Goldman. So many great guests. We can't do them all justice. Claire Smith, who was with ESPN, and she was rightly celebrating the news about the Negro League Baseball records now being part of Major League, it's being recognized as a major league, which is just absolutely incredible. So I know there were, there were 40 other shows we didn't mention. Those are just off the top of my head. Neil, anything else you want to say?
No, I just want to thank everyone for watching us and being part of the New York Times Read Along family, this community that Shri has built up over 5 years, that I've had a pleasure of working on for 3 years. And I say it at every occasion, to help produce the show, but also to be a guest host, to be entrusted with the show when Shri is not available is an incredible honor and a privilege. It's so great to work with such a fabulous team, Steve, Paula, Carla, Julia, every week, and particularly with, a year. Think about where we were a year ago. It was almost exactly a year ago that we started using this platform to do the show, and that made it that Paula and Steve had to work every weekend. It wasn't just an occasional gig for Paula to help out. It became a regular thing, and it really makes a huge difference. So thank you again to our team for doing such a great job, and of course to Shri for everything that he's done to support this effort over the years. Looking forward to a great 2021. We'll see you January 3rd. We'll take next week off, but our next show will be January 3rd. Thank you.
Thanks, everybody. Thank you, Lipi. Good luck.
Bye, everyone. So good to see you. Be safe.
Bye-bye.